Hey everyone, welcome back to the channel. Today, we're re-diving deep into a topic that has been all over the news and social media, Ozempic. You've probably heard the name, maybe seen celebrities talking about it. But what exactly is it? How does it work? And what are the things you absolutely need to know? Let's break it all down. First off, what is Ozempic? The active ingredient is called semaglutide. It is an injectable prescription medication that was originally developed and approved by the FDA way back in 2017 to treat type 2 diabetes. Its main job is to help adults with type 2 diabetes manage their blood sugar levels. And it's also been shown to reduce the risk of major cardiovascular events like heart attacks and strokes in those same patients who also have known heart disease. So, its primary approved use is for diabetes management. So how does it actually do that? Ozempic belongs to a class of drugs called GLP-1 receptor agonists. That's a mouthful, I know. But think of it this way. GLP-1 is a natural hormone our bodies produce. When we eat, our intestines release GLP-1, which then signals the pancreas to release insulin. Insulin helps our cells absorb sugar from the blood, which lowers our blood sugar levels. Ozempic mimics this natural GLP-1 hormone. It stimulates your pancreas to release insulin when your blood sugar is high. It helps prevent your liver from making and releasing too much sugar, and it slows down how quickly food leaves your stomach. This combination is fantastic for controlling blood sugar in people with type 2 diabetes. Now, let's talk about the elephant in the room: weight loss. The reason Ozempic became a household name is because of its significant effect on body weight. That's slowing down of food, leaving the stomach effect I just mentioned. It makes you feel fuller for longer. This is called delayed gastric emptying. When you feel full, you naturally tend to eat less. On top of that, GLP-1 agonists also work on the appetite centers in your brain, directly reducing your hunger and cravings. So, people taking Ozempic often experience a significant reduction in appetite, leading to lower calorie intake and, consequently, weight loss. Because of this powerful weight loss effect, the same active ingredient semaglutide was studied specifically for weight management. This led to the approval of a higher dose version under a different brand name, Wegovy. Wegovy is specifically FDA approved for chronic weight management in adults who are obese or overweight with at least one weight-related condition, like high blood pressure or high cholesterol. So, while Ozempic is for diabetes, its off-label use for weight loss has exploded in popularity. Off-label just means a doctor prescribes a drug for a condition other than what it was officially approved for. This is a common and legal practice in medicine when a doctor believes it's medically appropriate for their patient. So, it sounds like a miracle drug, right? Well, like any medication, it's not without its side effects. It's crucial to be aware of these. The most common side effects are gastrointestinal. We're talking about things like nausea, vomiting, diarrhea, stomach pain, and constipation. For many people, these side effects are most noticeable when they first start the medication or when the dose is increased. And they often lessen over time as the body adjusts. That feeling of fullness can sometimes cross the line into uncomfortable nausea for some individuals. There are also more serious, though less common, potential side effects that you and your doctor need to be aware of. One is the risk of pancreatitis, which is inflammation of the pancreas. This can be a very serious condition. Symptoms include severe pain in your abdomen that doesn't go away and might spread to your back. If you experience that, you need to seek medical help immediately. So, other potential issues include changes in vision, especially for people with diabetic retinopathy and kidney problems. There have also been concerns about gallbladder issues, like gallstones. And there's a very important warning that comes with Ozempic. In studies with rodents, semaglutide caused thyroid sessile tumors. It's unknown if it has the same effect in humans. Because of this risk, there is a boxed warning, the FDA's most serious kind, in the label. This means you should not use Ozempic if you or a family member have ever had a type of thyroid cancer called medullary thyroid carcinoma, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2. It's a very specific but very important contraindication. Let's also talk about what happens when you stop taking it. This is a really important point. Ozempic and similar medications are designed for long-term use. The effects on blood sugar and appetite are only present while you are actively taking the drug. Studies and anecdotal reports show that when people stop taking it, their appetite often returns to what it was before, sometimes with a vengeance. As a result, many people regain the weight they lost, sometimes very quickly. This isn't a failure of the person. It's the biological effect of the medication wearing off. So, it's not a short-term fix. It's a tool for chronic management. Whether for diabetes or weight, plan to use it should also include a long-term strategy, which might mean staying on the medication or having a very solid plan for maintaining. Lifestyle changes after stopping. Who is a good candidate for this medication? This is a decision that can only be made with a qualified healthcare professional. Generally, for its approved use, it's adults with type 2 diabetes. For off-label weight loss, a doctor would assess your overall health, your body mass index, or BMI, any weight-related health conditions you have, your history of trying other weight loss methods. It's definitely not for someone who just wants to lose a few pounds for an event. This is a serious medication for a chronic medical condition. It's also important to remember that these medications are designed to be used alongside lifestyle changes. That means a healthy diet and regular physical activity. They are a tool to help make those lifestyle changes more effective, not a replacement for them. The best results, both for diabetes control and weight management, are seen in people who combine the medication with a commitment to a healthier lifestyle. Let's quickly recap. Ozempic is a GLP-1 agonist, an injectable medication FDA approved to treat type 2 diabetes and reduce cardiovascular risk in that population. It works by helping control blood sugar and has a significant side effect of weight loss, which it achieves by slowing digestion and suppressing appetite. This has led to its widespread off-label use for weight management. Common side effects are mostly gastrointestinal, but more serious risks like pancreatitis and a potential risk for certain thyroid tumors exist. It's a long-term medication, and stopping it often leads to weight regain. The conversation around Ozempic is complex. It's a powerful tool that has been life-changing for many people struggling with diabetes and obesity. But it is also a serious prescription drug with real side effects and risks that shouldn't be taken lightly. The social media hype often glosses over the medical realities. Few are considering this medication. The most important step is to have an open, honest conversation with your doctor. They can help you weigh the potential benefits against the risks for your specific situation. If you or someone you know is struggling with issues related to weight, body image, or eating, please know there is help available. Talking to a doctor, a registered dietitian, or a mental health professional can provide support and guidance. We'll leave some resources in the description below. Thanks so much for watching today. I hope this cleared up some of the questions you had about Ozempic. If you found this video helpful, please give it a thumbs up and consider subscribing for more deep dives into health and wellness topics. Let me know your thoughts in the comments, and we'll see you in the next video.